Hey friends, today we're talking about liver disorders and related conditions under Part 7 of BNF Chapter 1. But before we start the video, let me tell you something important. If you're watching these BNF videos, you are definitely a good student, someone who really wants to learn properly, because here we focus only on the most important and high-yield points from the BNF. And remember, if there's anything you don't fully understand, pause the video, look it up, and learn it on your own too. That's how you become a strong medical learner, right? All right, friends, let's begin the topic, liver disorders and related conditions. Under this section, the first major group is biliary disorders. And within biliary disorders, the first condition we study is cholestasis. Let's understand it step by step. What is cholestasis? Cholestasis simply means that bile formation or bile flow is impaired. Because of this, bile cannot move properly through the liver and biliary system. Symptoms you must know: fatigue, pruritus, intense itching, dark-colored urine, pale or clay-colored stools, jaundice, fat-soluble vitamin deficiencies A, D, E, K. These happen because bile is needed to absorb fat-soluble vitamins. Treatment of cholestatic pruritus, BNF, says several drugs are used, even though evidence is limited. The first one is cholestyramine, which is considered the drug of choice for cholestasis-related itching. Cholestyramine is an anion exchange resin, and an important thing to remember is that it is not absorbed from the gastrointestinal tract. So how does it work? Inside the intestine, cholestyramine binds to bile acids and forms an insoluble complex. Because of this binding, bile acids cannot be reabsorbed and are instead eliminated from the body. As a result, the level of bile acids in the blood comes down. When blood bile acid levels reduce, their deposition in the skin also decreases, and that's why the patient experiences less itching. Due to this strong effect on bile acid removal, cholestyramine is considered the first-line treatment for pruritus in cholestasis. Here's a quick task for you. Do you know what an anion exchange resin is? If not, pause the video for a minute, quickly look it up, and then come right back. This part will make way more sense. The next one is ursodeoxycholic acid. This medicine can provide a small and variable benefit in patients with cholestatic itching. However, it's important to understand that its effect on itch relief is not very strong. When we compare it with cholestyramine, ursodeoxycholic acid is less effective for controlling pruritus. So, while it may help some patients, it is not considered the first-line option for cholestatic itch. The third one is rifampicin, and this is an unlicensed use. Rifampicin is used as an alternative option when itching continues despite first-line treatment. So if medicines like cholestyramine don't give enough relief, rifampicin may be considered. However, there is an important caution here. Rifampicin must be used very carefully in patients with liver disease because it carries a risk of hepatotoxicity. That's why liver function should always be monitored when this drug is used. Next, we have sertraline and naltrexone. Both are used in an unlicensed manner. These medicines are considered only when all the previous treatments have failed to control the itching. It's important to remember that both sertraline and naltrexone are associated with significant side effects. Because of this, their use is quite limited, and they are reserved as last-line options in managing cholestatic pruritus. Next, let's talk about intrahepatic cholestasis of pregnancy, which usually occurs in the late stages of pregnancy. This condition is important because it can be associated with adverse fetal outcomes, so timely management matters. One medicine that can help is ursodeoxycholic acid, which reduces pregnancy-related itching. The good news is that when used in the later stages of pregnancy, it does not affect birth weight or increase the risk of preterm delivery. However, there is limited data on the safety of ursodeoxycholic acid if used in the first trimester, so caution is advised during early pregnancy. Next, let's discuss gallstones, also known as cholelithiasis. Gallstones form when hard deposits made of minerals or fat develop in the gallbladder. When we talk about gallstone disease, it doesn't just mean the stones themselves. It also includes stones in the bile duct, the symptoms they cause, and the possible complications. The most important point to remember is that most patients with gallstones are completely asymptomatic. Symptoms usually appear only when the stones start to irritate the gallbladder or block the biliary system. When symptoms or complications occur, they can include biliary colic, acute cholecystitis, cholangitis, pancreatitis, or obstructive jaundice. Now let's talk about treatment. For asymptomatic stones, usually no treatment is needed. However, for symptomatic stones, the definitive solution is laparoscopic cholecystectomy, which removes the gallbladder and addresses stones in the bile ducts as well. Drug treatment, on the other hand, is used only for pain relief. For intermittent mild to moderate pain, paracetamol or NSAIDs are recommended. If the pain is severe, intramuscular diclofenac can be used. And if diclofenac isn't suitable, an IM opioid such as morphine or pethidine may be given. An important BNF point to remember, ursodeoxycholic acid has no evidence for treating gallstone disease, so it's not recommended. Next, let's look at inborn errors of primary bile acid synthesis. These are rare genetic disorders where the liver cannot produce enough primary bile acids due to enzyme deficiencies. The main primary bile acids to remember are cholic acid and chenodeoxycholic acid. For treatment, there are a few options. The first is cholic acid, which is a licensed treatment. It's used when there is an inborn deficiency of two specific enzymes and works by replacing the missing bile acids. The second is chenodeoxycholic acid, also a licensed treatment. This is used for one particular enzyme deficiency that presents as cerebrotendinous xanthomatosis, a rare inherited metabolic disorder. Finally, ursodeoxycholic acid was used in the past, but according to the BNF, there is no evidence to recommend its use, so it is not advised. Next, let's talk about primary biliary cholangitis, or PBC. You may also hear it called primary biliary cirrhosis, but the name has been updated. PBC is a chronic cholestatic liver disease that occurs due to the progressive destruction of small and intermediate bile ducts in the liver. Over time, this leads to fibrosis and can eventually progress to cirrhosis. When it comes to treatment, the first-line medicine is ursodeoxycholic acid. This is recommended for all patients, even if they don't have any symptoms. Ursodeoxycholic acid helps to slow disease progression, although its effect on overall survival is still uncertain. In cases of advanced PBC where the disease has caused significant liver damage, a liver transplant may be considered as a definitive treatment option. I hope now you have a clear idea of cholestasis, gallstones, inborn errors of bile acid synthesis, and primary biliary cholangitis, along with all the important medicines and their drug classes. In the next video, we'll move on to obesity and its treatment, so make sure you don't miss it. If you found this video helpful, don't forget to like, share, and subscribe. It really supports the channel and helps us make more study-friendly videos for you. Keep studying, stay curious, and I'll see you in the next video.